Hey everyone, it's David. I'm here in Orlando at HIMSS 2022 in the middle of the Cerner booth. It's about 8,000 square feet. And you know, it's sort of overwhelming, all of this stuff, but the reason that we do this is so we can connect with friends and learn. And that's why we're here today. So I got my friend Dr. Ehab Hanna with me here. And this guy really stands out among a lot of people that has figured out how to take healthcare, combining with informatics, and change organizations at scale. Like if you really think about that, that's a very, very long gravel road that he's probably walked on. So I wanted to start out, Ehab, with introducing you, but tell us your story of like how you got here, and then I'm going to ask, what'd you learn? Because I think a lot of people would love to hear those lessons, and then we should talk about the future and what we think we really can accomplish together.
Well, first, thank you, David, for the opportunity. It's a privilege to speak with you and be here. I've been very lucky in my life where at a young age I knew that my value as a human being based on my contribution to the world and my community. Medical school and being a physician was a clear path for me. I did my medical school in Egypt, came to the US, did my residency, got my first job as a hospitalist, was very excited. A few years into it, realized how much healthcare could use some help in delivering the care to our patients. I was sitting on IT committees, found opportunity and hope in the new technology to help us not only connect with our patients better, deliver better care. You've seen the evidence. It takes us 10 to 20 years for the evidence to make it to practice. In the 21st century, I think that's something that we could improve a lot upon. So it was a natural movement for me to sit on IT, became an assistant CMIO at a progressive healthcare system, and then started the journey of how do we use the tools. They were using Cerner. I was using Cerner as a practicing hospitalist. And then we started working on how do we optimize the tools for our physicians. Everybody from my peers was, I'll wait until it's perfected and then bring it to me. And what I've always said to them is, we got to work on it. We got to work on it together. The IT teams cannot fix it for us on their own. They need our help. And step by step, we focused on what's important, and then we started working through that. And here we are.
I love it. So when my wife would drop the kids off at school, every day she would say to them, make the world a better place, right? And I think it's a really important message that you figured that out early. My coming here is that, and I think we agree on this one, is that I think using technology, we have the opportunity to actually make the world a better place, and especially in our world in healthcare, right?
Yes.
It's been so missing and oftentimes not usable.
Yep.
And like those colleague doctors of yours who said, hey, I'll wait till it's perfect, like we're still far from perfect. But I think the promise is that the technology could really make the world a better place.
Yes.
I also am nervous that sometimes I think we get it backwards, that we think that it's about the technology. It's really about the caring, and the technology is a tool.
Correct.
So tell me how you balance that and how you've thought about that. I'd love to learn more.
Yeah, I mean, I think you put it right. I mean, as long as you put the patient in the center of it, remind people what our mission is. And we're not using the technology just for the sake of the technology. And I understand that sometimes we use process measures. Did we use the application as a way to say we are on the right path? Sometimes measuring outcomes, and you know, if you're a primary care physician and you need to figure out what your outcomes are, you got to wait for your patients for 20, 30 years to see, have you prevented a heart attack, have you prevented a bypass? So sometimes that outcomes measures is a little bit more complicated to measure. So we try to find surrogate measures, process measures in the process. And that sometimes makes people forget that it's about the patient, it's about the care, and it's about the outcome. As a hospitalist, it was a bit easier to measure outcomes. So did we have readmission?
Yeah.
Did we have complications? Did we have, And then you put the process, you explain how is the physician entering the order, getting the decision support, preventing an error from happening, going and making it to the patient is what you're trying to accomplish. So that's really what we're,
Give me some examples. So I know you folks have used Care Aware, Connect, Capacity Management, Infusion, M-Pages, like, I probably shouldn't say this publicly, but you probably know Cerner better than Cerner. So tell me like examples where you've been able to use those things to achieve what you're talking about.
Yep, so a perfect example was Cerner has a tool called M-Pages. And I'm a big fan of M-Pages. My health system is one of the top users of M-Pages. It's what clinicians have asked for many years. I want one place where I found my information that I'm looking for. I can put my notes. I don't have to go around hunting for things. I can sort it the way I want. One of the things that we struggled with, there were medications that were about to fall off the mark. They were due to be renewed.
Yep.
And we needed to find a process where physicians would remember to renew them. There were communications from nurses to doctors that in the paper world, when we used it, there was those yellow stickies in the chart. We needed to find an equivalent in the computer system to remind physicians of these honey-do lists, if you will.
Yeah, renew the antibiotic.
Renew the antibiotic. Call the daughter before you do. So what we did was Cerner gives a developer license as part of the M-Pages. You can create widgets on top of the M-Pages platform, sort of like apps on top of the iOS store. So we went and created a physician communication widget that the first section of it would say, hey, these medications need to be renewed. Once you complete that, hey, the Foley catheter is due to be removed. Do you want to take it out? The central line has been day 3. Do you want to keep it or do you want to remove it? And by the way, there are these 2 messages from nurses for you. And so one place, one-stop shop for the physicians to do. And that made it a lot easier for people to respond to those key messages, key care quality items, without having to go hunting for it in the EMR.
And you built that on top of M-Pages.
And we built that on top of M-Pages. Yep. It's a sort of think about it as an app inside of the M-Pages. And that's one of a handful of things that we have done in that space.
And while it sounds fantastic, I think it's what our customers, docs, nurses, techs, have been expecting and wanting. So do they appreciate it, or do they go, yeah, finally, of course this should be here? Like, what's the feedback? Because you got a really hard job in that the people that you're serving, your clinicians, use tech in the outside that does all this stuff. It's always just been slow to come to healthcare. So you bring it in, pretty innovative, totally makes sense to me as a clinician. Do they appreciate it, or do they say, hey, I need more, like, and this doesn't? What's the vibe?
I think there are 2 camps. There are the ones that don't believe that the computer is ever going to help them.
Okay.
And they're resisting.
Yeah.
And there are the ones that are say, how far behind is the EMR? So the ones that are how far behind the EMR are always say, yep, I need more. I appreciate what you have, but I need more. The ones that are resisting actually is interesting. I visited one of our hospitals, and I was talking to them about the new system that's coming back, and this is what we need to do. And one of the physicians was articulating to me what would he envision for a system to help them remember to renew the medications, and basically describe what we just did. And I was like, yep, here it is, let me show it to you. So those were the moments where people were like, okay, I think you're trying to help me here.
Yeah, huge.
And this tool can actually give me, at heart, all of us want to provide better care. None of us wake up in the morning and says, I'm going to be average or below average. But we doubt sometimes whether the computer is actually going to help us deliver this. And we needed to show them the wins so that they can take those wins.
Yeah, you know, I think none of us, Cerner included, in this space, have ever really built with the user in mind. And when you can show that kind of example, I think it says to the user, you actually matter. We're going to treat you with dignity and not make you be a clerk.
Yes.
So I think that's fantastic. You guys use a lot, well, UHS is a huge system. So you got a big job. You're a big user of our Healthy EDW.
Yeah.
Can you explain to folks what that is, how you use it?
I'm a big fan of health.
And tell me the strengths and the weaknesses and what we can do with it.
Yeah, so let me tell you a story of, I just got an email from the CIO. He went into our COVID dashboard and took a screenshot, I can show it to you, of how is the last wave ending and how is the population. So my health system was able to create this dashboard within 2 weeks of the start of the pandemic. And this while we were actually building the fields inside of Cerner, inside of Millennium, and in my mind, the magic is when Healthy Intent sits on top of Millennium, and I know you've had Healthy Intent sitting on top of Epic, but I would imagine there were some interfaces that needed to happen. In my environment, I didn't need an interface. As soon as I built a question, were you vaccinated?
In Millennium?
In Millennium. It was there for me to report on it on my dashboard. And that's just the power that we need today to be able to respond to a pandemic like what we went through. So that's, from my perspective, that integration. Your EMR is one of your heaviest, most complex databases that you will ever have. And having an EDW that sits on top of it, where you don't have to worry about every time you create something new here that you have to update your interface and make sure it flows there. For me, it was a big win. It was a simple, easy. One of the challenges in healthcare in the US is cost. And cost impacts access, equity. There's a lot of, I would love to be able to show that we can provide high quality care in an efficient manner. I can't hire a readmission preventionist to make sure. I need to be able to embed the workflow. I need the computer to do the majority of the heavy lifting and not add another burden, add another. One of the most expensive things in my health system are our staff. And I want the staff to spend time with our patients, not filling forms. So we had to rework the process with the readmission to be a more streamlined, more efficient, take away documentation that would be nice to have in a perfect environment, but not necessary to have.
So in the optimization process, you can get rid of some, let's say, not necessary documentation. As I've visited with customers, I'm hearing over and over the issues around nursing and staffing. Nurses are spending 50% of the time at the terminal, 30% of the time looking for supplies, and 20% of the time with the patient. So just think if we can optimize their work such that they got more time with the patient. One, it would be a huge satisfier for them, but allows us to have more nursing time because we're taking them away from the computer. So that's crucial. Can I switch gears to something that I'm very passionate about, is behavioral health. So you guys have been a leader in that. And I remember as a practicing child psychiatrist, either inpatient or outpatient, it felt like different than other medical specialties, and it was so team-based. Like I needed to know what was happening in school, occupational therapy, rec therapy, the psychologist, the family, pulling all the information. Now I think the rest of medicine could learn from that. Tell me how you're thinking about behavioral health, what you're doing, and how that multidisciplinary treatment plan that we know in behavioral health you think applies in other areas.
Yeah, no, I absolutely agree. I think behavioral health is really ahead of other disciplines around team-based care. Healthcare is a team sport, and I can't say it enough. And we don't build that team. I wish we do a better job in different areas, in different parts of the care. But yes, we are a big behavioral health division. We are looking at designing a team-based process that basically integrates what the doctors are doing, psychiatrists, the hospitalists, what the nurses, what the therapist documentation. But at the top of it is what it is really our goal. What are we taking care for the patient? What's the problem that the patient is presenting with? What are our goals for achieving? When do we expect those to happen? And who's doing what? I think of it as a mathematics algorithm. And who's doing what, and what we're embedding it inside of Cerner to get if a doctor completes a task or if a therapist completes a task, it updates their treatment plan. And vice versa. If you're in the treatment plan, you can update a task that will remove it from your task list. So that integrated workflow, in the paper process, I'm sure you know, there was a piece of paper as treatment plan. And there was a piece of paper that was called a note for here. And the computer enables us to actually connect. It's a much better tool than we have. So we're very excited about that.
Yeah, my vision is that really these progress notes don't make any sense. What I want is a dashboard about myself, and as people do things, my health either improves or not improves, right? And that's kind of what you're starting to describe. It's fascinating. Hey, I knew this was going to be fun. I learn every time I sit down with you. We're excited for all you folks that tuned in. We got a bunch more stuff coming up streaming live from HIMSS here in Orlando, HIMSS 2022. Thanks so much.